Have you ever noticed blood in the pan or commode or on the toilet paper after you just passed stool and came out? Then this video might be very helpful. And if you haven't, there's a potential chance you might in the future might as well go through it. If you have clicked on the thumbnail and then you want to know about this, you are curious about it. Whenever a person or a patient sees bleeding while passing stool, there are two usual responses that we see. One, some patients really panic. It's super frightening for them. They want an immediate assessment, rule out cancer. Cancer is the only thing coming to their mind. They use Google today, they use AI, and they have already concluded before coming to us that it's cancer and it's a heavy stage. They say I've lost 2 kgs in the last 3 months, so there's weight loss also, and then they're worried. There is a second group which takes it very, very lightly, which ignores it, says, oh, it's piles, half the world has it, and I'll just change some toilet habits, some dietary habits, and it will improve. See, both are extremes and both are not the correct approaches. Why am I talking about it? I am Dr. Gaurav Gangwani, a board equivalent certified interventional radiologist, a minimally invasive specialist who can treat various diseases like piles without a blade, without any sutures, without any scar, without any anesthesia, without need of a detailed admission and a very rapid recovery. And especially when it comes to piles, without even taking off your pants. But that is only for the advanced cases. And right now we are not talking about that. We will talk about that in many videos. But right now our focus is when you have bleeding, what can be the causes, what are the red flags, and when you should see a doctor. So in this video, I will be talking on the top 5 most common causes of bleeding in the stool. But what kind of bleeding? Let's understand that first. See, your digestive passage starts from your mouth, food pipe, stomach, small intestine, and then finally the large intestine ends into the anus. Bleeding anywhere can manifest in the stool in various forms. If the bleeding is very close to the anus, the terminal large intestine, or just anus or rectum itself, the topic of video today, we will only be talking about this type of bleeding. But if it is slightly higher up, slightly proximal from the proximal large intestine, it would appear as brownish, maroonish, or old blood. I mean dark red blood, not bright red blood. And if it's even higher up, the proximal small intestine, stomach, it would just appear as black tarry stools, because after such a long passage, the blood has practically mixed with the stool and made it black. So you won't even see bright red blood or blood separately from the stool. All you will see is black tarry stools. That is also concerning. In this video, I'm not going to cover all 3 types of bleeding right now, because we are confusing this bleeding only with piles. We want to study the 5 causes only of this type of bleeding, the common causes, not an exhaustive list of every possible cause. The commonest cause is, of course, piles, which tops the chart. We know piles by various names, like internal hemorrhoids. But what is exactly piles? Your anus has area of blood vessel connections, or a bunch of them together at 3 places, and these are known as endovascular cushions. They are surrounded by a network of connective tissue which holds them in place, and it has various functions of supplying blood to the mucosa. Due to constipation, due to bad food habits, bad toilet habits, less movement, the supporting structure, the anchor, gets weak, and the blood flow increases to this area because of inflammation, various issues, constipation, and straining or pressure. These structures can start prolapsing out, and because it's already prolapsing, bulging, thinned out, constant irritation by the constipation and the stool, it can also rupture and bleed. What do you usually see? It is usually painless bleeding in the beginning, onset of anal spasm and clotting. It can start paining, but usually it's painless. You start feeling that there is a lump or a soft cushion that's jutting out, prolapsing. You many times feel that. You feel itching, you feel heaviness and pain sometimes, later stages, like I said, due to various reasons. And of course, bleeding is always there most of the time. So this is how a usual piles patient would present. We have treated not one but many patients who have had piles for a long time now. When they come to us, their hemoglobin is to the range of 5 to 6. So it needs treatment and it can't be ignored. But yes, not every bright bleeding is piles. Not every painless bright bleeding is also piles. There can be other causes to it. Let's jump to the other causes. So hemorrhoids part, of course, we do treat this condition without surgery today, without the need to even remove your pants, something known as hemorrhoid artery embolization, an angiography-based technique where you don't even need to remove your pants. We can do it through your wrist. Occasionally, we need to do it from your groin or upper thigh, but it's, like I said, minimally invasive angiographically. You are awake and 3 hours later, you can leave the hospital. If you do it from the thigh, 6 hours later. This video is not regarding that. We will make a detailed video on it in future very soon. Right now, let's jump to our second cause, which is a very common cause of bright red blood seen on the toilet paper or the pad, and that's anal fissures. When the stool is very, very hard, there's strong constipation, it can lead to a tear in the perianal skin, and that is very painful. So the difference from piles is that initially that's painless. This is many times relatively abrupt but very painful. The pain is always triggered during stool, but sometimes lasts hours and makes the life hellish. Luckily, because it's a tear, most cases we can manage it with stool softeners, high fiber diet, some creams, good creams which can numb that area and reduce the pain also and allow it to heal faster. And sits bath, meaning asking you to sit in a tub full of hot water, lukewarm water, so that it gets some blood flowing across for healing to occur. And of course, some soothing. So fissures are relatively easy to treat, but if there is pain, of course, visit a surgeon. Some extreme cases might require surgery also, or refractory or recurrent cases. Third most commonest reason is something known as colonic polyps. Most of the times, these are mucosal outgrowths which are benign in nature, non-cancerous. Some of them can have a propensity to turn into cancer later, known as malignant transformation. Can't ignore them. Many countries have a colonoscopy screening program to detect them early, usually after 40s, every year annual colonoscopy. But if you have a bleeding which is intermittent, not every time you pass stool, goes off for a few days, comes back, there is a chance we are dealing with this. And if it's painless, definitely needs further evaluation and management then. Most of the times you can do a colonoscopy, decide whether it's a low-grade polyp or a relatively suspicious high-grade polyp, and either they allow surveillance or then they can remove it, depends on the picture and the suspicion. Easy to deal with. The fourth commonest cause is infection. If your bleeding has been accompanied by sudden onset cramps and abdominal pains or heavy pain, there's diarrhea, fever, mucus in the stool, weakness, high chances we are dealing here with either food poisoning or an colonic infection or colitis, and antibiotics and anti-inflammatory most of the time should work, of course after a proper consult. And the last and concerning diagnosis is colonic cancer, which we have seen enough patients, testimonials, anecdotal reports in our lives, as well as if you browse YouTube, you will get a few of them who have narrated their stories where they have been decently ignoring the bleeding, considering it piles for a long time. Some of them did have piles also on proctoscopy, but the real reason was a hidden cancer upwards and they missed it. By the time they detected it, it was stage 4 and they had to go a hell lot of procedures, chemotherapy, immunotherapy, which could have been early detected and just been treated with a simple colectomy or even a polypectomy. So, point is that if there is any red flag, if bleeding is more beyond 2 to 4 weeks, if it's accompanied by pain, if there is a pencil thin stool suggesting that there might be some obstruction upwards proximal, which is causing the stool to get thin and then come out, these are concerning. If the bleeding is causing anemia or dizziness, weakness, if it's accompanied by a significant weight loss, loss of appetite, definitely concerning. And there can be an exhaustive list of ancillary symptoms of cancer, but these are red flags, prominent ones, common ones, and you can't ignore it anymore. So friends, and of course I would say if you're above 40 and you notice bleed even once, definitely visit, because age does factor in a concern. Every decade chances of cancer being one of the possibilities increases, so let's not ignore it if you're above 40. Even if it's piles, one extra consult, one simple PR examination or proctoscopy doesn't harm you, but missing something that is potentially sinister and can evolve into something sinister is probably fatal or harmful and won't want regrets later. So with this, I would like to urge you to write in the comment section if there is any particular problem nagging you, and if you want to explore whether there are interventional radiology solutions to it without surgery. And of course, if you want me to make a video on piles, do mention in the comment box and I will make a detailed video on piles, hemorrhoids and hemorrhoid artery embolization. If you want to know the difference between piles, fissures and fistula, you can tag as well. I spoke about piles and fissures, but we'll add fistula as well and make a detailed video on that too. Stay safe, stay empowered.